Okay. Good morning.
Good morning,
I'm Dr. Alan. How should I address you?
I'm Hazura.
Hi, Hazura. How are you today?
I think I feel fine.
You feel fine. Oh, that's good to hear that. How can I help you today?
Actually, I just got married recently, and then I did my period came late, so I did a self pregnancy test, and then it come back as positive lah. So today I come for a checkup.
Oh, come for a checkup. Okay, so it's congratulations
Thank you very much.
to hear the news, right? So you must be very happy, I assume.
Yes.
And with your husband, yeah.
Yes.
Yes. So okay, before that, I would like to ask a little bit more about your condition, right? So from the, I was informed that you are 40 years old now, is it?
Yes, I'm becoming 40 in 2 months' time.
Oh, okay. So is this your first pregnancy?
Yes, I never married before.
Oh, very before. Okay. So okay, as usual, when during the booking, we will ask you some question related to your pregnancy.
Okay.
So do you have any symptom like early morning nausea, vomiting, poor appetite? Do you have such feeling? Usually this will happen in the pregnant woman in the early phase.
So far, I felt nothing much
Nothing
happened
much.
to me lah. I feel fine. Yeah.
Alright. Okay. Do you have any medical illness before, such as diabetes, hypertension, dyslipidemia, asthma, or epilepsy, or other things before this?
Before this, I don't have any like worrying medical illness. But I have bronchial asthma during my childhood. But currently, there's no more, not on any medication lah.
No, any medication. Okay.
Only childhood.
Childhood. So, any medication. Do you have any history of admission due to the asthma before? Hospitalization.
Hospitalization. I think like during my childhood only lah. I think it's maybe like 7 years old, like my mom said. After that, no more.
No more. So, any history or any allergic to the drug or medication before?
So far, no.
No.
I don't have any allergy.
Any history of operation?
No, I don't have any.
Don't have any. Okay. So, okay, we will ask you regarding your menses condition. When was your last menses period?
I think it's around like 6 weeks ago.
6 weeks ago.
6 weeks ago.
Okay, alright. When was your menarche? The first period came.
My first period
what was the age?
Came at 14 years old.
Oh, 14 years old. Alright. Okay. But just now you mentioned your period was irregular, right? Oh, so can you tell me more about that? How irregular is it?
No, actually, I didn't tell you about the irregular menses. It comes regularly lah, around like 32 days, every 30 to 32 days lah. I have a record from it.
Yeah, record. That's good. Okay. So, okay, that's good. After this, I will examine you. Then we will test again the urine pregnancy to confirm your pregnancy. Then we will do a scan after this to confirm the viability of your fetus. And then we will do some physical examination on you. After that, I will ask, what is your occupation?
Actually, I'm a clerk.
Yeah, clerk.
I'm a clerk, yes.
How about your husband?
My husband works in business. He got some business. I don't know how to say it, but he's in business lah.
Okay.
So, doctor, I have some concern. Actually, so because I'm already approaching 40, so from what I read, there's a risk of having Down syndrome. If I proceed with the pregnancy. So will I have a Down syndrome baby?
Okay. Yeah, this is something I would like to discuss you. Just want to discuss with you. Okay. Actually, Down syndrome is a condition. How much do you know about it?
That's from what I read. The risk is higher if there's a what you call that? Like elderly mother lah. So elderly mother first, and this is my first pregnancy. It's very precious. So I'm a bit worried about that lah. And even though I don't have a family history of any what do you call that, Down syndrome in my family, but I still worried because from what I read, sometimes it can happen to anyone. What
yeah, it's good. What you say is correct. Actually, we will see the incident. So incident of Down syndrome among the pregnant lady depends on the age. Of course, as the age increase, the chances for you to get is increased. So for example, if your age is 30, the chances for you to get is about 1 in 1,500, no mistake. But at the age getting 35, the chance to get it probably is about 1 in 800 pregnancy. But for the age of approaching 40, the chance for you to get is about 1 in 100 pregnancy. So if it's okay, we will recommend you for the screening test actually, if you don't mind. But unfortunately, in the government setting, we cannot do it routinely due to some financial constraint. But if you don't mind, we can offer you several tests which you can be done in the private lab.
What test? What test?
Okay, since you are in the 6th week of pregnancy, they have the triple serum test, which you call it serum alpha fetoprotein, beta HCG level, and also another one is PAPP, the test called PAPPA. These 3 tests you can be taken. We will see its level, and then we will correlate with the risk of Down syndrome of your current pregnancy. And then second one, we can do the scan at the 12th week. We will see the thickness of the neck of your fetus, which we call it knuckle thickness. Then it can estimate the risk for the baby to get the Down syndrome as well. Then another third option will be we are taking your blood, and then we will isolate your blood and the fetus blood, because when you get pregnant, the fetus blood may circulate in your body. So we will take the fetus sample from your blood, and then we will send it for the DNA analysis. But of course, this test will be the most expensive. So basically, you have the 3 options actually.
Okay. So if I didn't do all the tests, I mean, like, okay, if I like I have I don't know whether my husband can afford it or not lah. But from scan can we know the patient have, I mean, like, my child have Down syndrome from the scan?
From the early scan, we try to detect it as early as possible.
Can we confirm by scan?
Ideally, we should confirm by the DNA testing, which is the best one. Will be the fetal DNA taken from the maternal blood, from your blood. This is the best one. But of course, the cost will be a few thousands in a second. For if cannot afford, then we will do some supportive, we call it supportive test to help us actually. Like the triple test and also the scan. These all are just supportive.
How many percentage that, I mean, like you said it's supportive, right? So how many percent that you will know that, okay, my child doesn't have Down syndrome?
I think this one I'm sorry to say, but I need to check with I will check and discuss with the ONG specialist, because I also not quite sure the exact number. I will check and then I will give you back the detail after that. Is it okay?
Okay, sure, no problem. But if I want to do all the tests, at what time that is possible for me to do all the blood tests and everything?
Preferable we do it now. It is okay as well as first trimester. So if there anything happen, we can offer you further management treatment. Ideally to be done in the first trimester. But of course, even though if entering the second trimester, other necessary can be done as well actually.
Okay. So for today?
For today, I think as I mentioned, the option we will given to you is sending the triple test and also the scan. But if you're able to afford, we can send you the fetal DNA extracted from the maternal blood. So if you can discuss with your husband, if you see how the cost, if affordable, you can give us your final decision, then we can proceed for you.
Okay, so when should I come back? I mean, like after today, do we have any review after this follow-up?
We shall see you back in about 2 weeks time after the scan, and then we will expecting your answer.
Okay, sure. Okay, alright. I will discuss with my husband later about this. Alright, thank you, Doctor.
Okay.
Apa
Slow
lupa?
weh.
Kenapa?
Tak ada.
Okay, any comments?
I think I
Comments from the floor?